Joining us right now to react to this developing news, we've got epidemiologist Dr. Raywat Deonandan. Welcome back.
Thank you.
You're our breaking news correspondent here on the show. So to put you on the spot a little bit, because I know we're still watching this news conference, just your general reaction to the clips we just heard.
Nothing is surprising there. I mean, we knew that the restrictions will have some positive benefits. And so by looking at the data last couple of days and weeks, this is the trend we're going towards. There is definitely some flattening. We've seen that for a while. But as noted, it's way too early to know where we are really in terms of crisis. And we're going to see hospitalization numbers rise well into December. That was known. In fact, we're still seeing the hangover from Thanksgiving. Just as we're going to see the hangover from the Christmas holidays well into January. So these are all lagging indicators. That's a tough thing for people to digest, but that's the nature of this game.
How can you tell the difference between what is a substantial flattening versus something that is not fully under control yet?
That's a really good question. It depends on how long the flattening is going on. What is the reproduction number? In Ontario right now, it's just below 1, which is great. Just below 1 means we are flattening. It means we are on path towards, diminishment. But it could very easily be just above 1 in a couple of days. So it's wavering on that plateau versus exponential growth border. So that's the delicateness of the fragility. Whereas in Ottawa, the reproduction number is significantly below 1, so we're looking much better. And he's absolutely right that this is a heterogeneous disease. It always has been, whether it's looking at the national picture, the global picture, or the provincial picture. Different spots around the province are looking different because there are different populations at play and different socioeconomic activities, different abilities to distance, and different levels of compliance.
Absolutely, and you and I have talked about that time and time again, that Toronto just has a very different situation than we do have here in Ottawa. And I was just mentioning that one thing that stunned me a bit, that 70% of Toronto cases have known epidemiological links.
Yeah, that's a function mostly, I think, of our contact tracing failures. And that, in turn, is a function of our inability to invest in contact tracing in this province. But also, Toronto, there are a lot more mass gathering opportunities. Transit systems are mass gathering opportunities, and you don't know who you've been exposed to in the subway system or the GO train. As well, people who live in crowded tenements, they don't know if the people they saw in the elevator that day was infected, and you don't know who they were, and so you can't report to a contact tracer that these people you're exposed to. So it doesn't surprise me. The inability to have good identification of contacts is what is at the core of our inability to make epidemiological links.
Let's focus in on Ottawa a little bit. Today, the picture isn't as rosy as perhaps it was yesterday, because yes, we're doing better than Toronto and Peel, but if you look at the 7-day wastewater surveillance data, the average is up. What do you make of that?
It's so confusing, isn't it? So, yes, the wastewater numbers are up, which means that there is a lingering presence here, and it will probably manifest soon in our other indicators. The other indicators, though, which are, again, lagging of the wastewater, show things are looking not fine, but better. Reproduction number below 1. Test positivity rate is below 2%, which is just great. It's going to go up. I mean, last time we spoke, I predicted that we're going to enter the red zone-ish areas. And I didn't want to give that prediction because it's so negative. But I think it's probably going to happen. And it's not due to anything that we're doing. It's just the disease seems to be just surging across the province, and we're going to have our turn at it very soon. So Ottawa has done so well in so many ways. And if we look at what the outcome indicator is we care about hospitalization, really. And that is diminishing. So right now, if I'm looking at top of the graph right now, our COVID hospitalizations are dropping significantly, which is great. But that could change any minute now, right? I mean, it's the same. I keep saying the same thing over and over again. Like, things look good now, but it could change any minute. That's because this is a living scenario. We're watching the game unfold in real time.
Right. And I guess what you're saying really falls into line with our medical officer of health, because just on Wednesday, she said, we're doing well, but we need to stay in this orange protect zone for a little bit longer. We're not moving into the yellow just yet because we need to see how things develop. So I guess my question about the wastewater is, how bad is it? Because we know things fluctuate. That's natural. Sometimes the levels go up one day, then they go down, and you're looking for a trend over time. So to say wastewater surveillance and the trend has gone up, the average over 7 days is one thing, but what's your read of the latest measurements in the wastewater and how significant that is?
Well, the 7-day viral signal has come up a little bit, but not as bad as it was, say, a couple of weeks ago. So we're still, and the trend seems to be wastewater as a wave-like fashion. Why that is happening, I'm not entirely sure. Is it waves of travelers coming in at a given time, or waves of diarrheal disease causing volume of efflux into the waste system? I have no idea. But the good news there is, even though the increase is happening, it's not anywhere near the previous peak that we saw a couple of weeks ago. So this fluctuation, this perturbation, this wave-like behavior is still trending downward.
That's good to know. On to the schools announcement today, and I'm going to have the education minister joining me coming up on the show, but I wanted to get your thoughts on this because here in Ottawa and in some of the other hotspots, Ontario is rolling out voluntary testing for asymptomatic people. So they're targeting these hotspots. After the holidays, the students will get COVID-19 refresher training on the first day back, and they're going to be launching these 2 new education portals as well. What do you think?
It's a good idea. Asymptomatic testing is something we should have always been doing, except that, of course, it really confuses our lab capacity. And when we had lab capacity issues in the late summer, we had to scale back to just symptomatic testing. And if you test asymptomatic, you have a higher probability of finding some false positives, which I know is a dangerous thing to say, but that's the way the statistics work out. The reason we need to test for asymptomatics is when the transmission is out of control, it's coming from somewhere. Asymptomatic people are less likely to transmit, about 42% less likely, and they constitute about 17% of all infected people. So they aren't a significant portion of the population, but they are contributing. And if you're trying to control spread in a place like a school, well, it makes perfect sense to try to get those silent spreaders and identify them early. And the thing about asymptomatic is we have to distinguish between asymptomatic and pre-symptomatic. They're distinct concepts here. And I think we're deliberately mixing them together. Asymptomatic people will never show symptoms at all. Pre-symptomatic people just haven't developed the symptoms yet. If we can identify those people, well, that's great. We can quarantine them before they become symptomatic and get really, really infectious. And the asymptomatic ones, we take them out of the picture, we've gained a little bit. So overall, I think it's a good strategy if we have the testing capacity to do so. That's the big if.
Right, because you don't want to backlog everything. In a perfect world, if we did have the capacity, where else should we be doing something like that?
The border. Any incoming traveler should be tested. We should use our rapid antigen test for that purpose. We can use it for people visiting their loved ones in long-term care centers. We can use it for people who work in the transit system. Teachers, I think, should be tested regularly. So, there's opportunities here. And if the vaccine were not coming, and it is coming, then we should be focusing entirely on getting as much testing capacity as we can, and that is our path to normality in absence of a solution like a vaccine.
Okay, but is it coming? That's the thing. I guess it's not is it coming, it's when is it coming. I think a lot of people are on edge right now, as you can understand, because today at a background briefing we learned that Health Canada will be getting approval of the vaccines within days of the United States. They've got a plan to vaccinate 20 million Americans in December, but the government here hasn't publicly stated what our plan is. And so there's concern when you see the U.S., Mexico, the UK, that they've been putting out their plans publicly, and we don't have a lot of information. Then factor in the back and forth between the provincial government saying, we're in the dark, we don't think we're receiving vaccines in early 2021, and then the federal government saying, you're wrong. Contradicting you, we're going to get the vaccines, insisting that we'll have the vaccine in early 2021.
I think we're going to have it soon. The log jams, of course, are licensing and manufacturing and distribution. We can control the other things. We can control the speeding up Health Canada's approval of it, and we can plan for distribution. We cannot control for the manufacturing and arrival of the vaccine. That's out of the hands of Canadians. I think. There is some talk that we have manufacturing capacity here that's controversial, so maybe that's not the case. But if I had to be a betting man, I'd say we have doses in arms before February in Canada.
I would hope so. I hope that's the case, because it would be a difficult situation. And I'm not just talking politically, because, of course, it's a nightmare politically when Canadians are seeing Americans rolling up their sleeves. But it would be a very big challenge public health-wise as well, wouldn't it, if America were to get way ahead of us and they start to put pressure on wanting to open up the border and travel, et cetera, et cetera.
there's a real chance that they will have a faster path to herd immunity than we will, because frankly they have better access to more vaccines, as will the Brits. So our advantage, though, is we have a plan for national distribution. Not a lot of other countries have that. They have a plan for getting a lot of vaccines, but not really how to distribute to everybody. And we have a plan to get into every arm, and we have deals with a lot of manufacturers, more than any other country, to get a diversity of vaccines here. So overall, we are looking good, but we could look better.
Dr. Raywat Deonandan, great to have you on the show. Thanks so much.
Thank you. Bye-bye.